Partially compensated arterial blood gases confuse many nurses because every single value appears abnormal. When you look at the results, the pH remains outside the normal range, indicating the primary imbalance persists. It is the complex middle ground between a fresh respiratory or metabolic insult and full recovery.
In partial compensation, the pH is still abnormal, but both PaCO2 and HCO3 have moved in opposite directions. The lungs or kidneys are working overtime to neutralize the acid-base shift, but they have not reached equilibrium yet. This signifies an ongoing physiological battle to restore homeostatic balance.
The key takeaway is that partial compensation equals effort in progress. As a nurse, you must monitor for trends toward normalization while treating the underlying cause of the distress. Your goal is to see the pH return to safe levels through targeted clinical interventions and support.